All right, welcome back to the KFYR Plus News Desk. And heart disease now remains the number one cause of death in the U.S., leaving millions struggling with chronic disease. However, research shows that 80% of cardiovascular deaths can be prevented through management of risk factors such as high cholesterol and high lipoprotein A. A simple blood test can provide some vital information about our risk and an opportunity for, prevention. Founder and CEO of Family Heart Foundation, Catherine Weilman, and Chief Medical Officer, Dr. Larry Sperling, are joining us live from Atlanta this morning with information that could help save our life. Good morning.
Good
Morning,
morning.
Jay.
Dr. Sperling, let's start with you. Can you share more about the impact that cardiovascular disease has on us Americans?
Cardiovascular disease has a significant impact on most Americans. In fact, most Americans are at risk for heart disease and stroke. Every 33 seconds, a person dies in this country of heart disease. So during our interview together, it'll be 6 Americans that die of heart disease. Now, this doesn't have to happen because most heart disease can be prevented. It can be prevented through awareness of risk and awareness of risk factors.
And what are some of the ways that we can help try to combat this heart disease?
We can all begin combating heart disease and preventing heart disease through awareness of risk factors and addressing these risk factors. Today, we'll talk about 2, LDL cholesterol. By lowering the LDL, we can reduce the risk of heart disease and stroke. The other risk factor we want to speak about today is called lipoprotein(a), or Lp(a). This is a genetically determined risk factor that is very common, but unfortunately, most are completely unaware of their Lp(a) levels. 1 out of every 5 people worldwide have a high Lp(a). It's a powerful heart disease risk factor. As you mentioned in your opening, through a simple blood test, we can all know our LDL and our Lp(a). This is the first step towards prevention, action, partnership with your doctor and your clinical team.
Is there a certain age that people should possibly maybe get, the blood drawn in a test, or is it something that maybe during a routine physical we need to have done?
For adults, all Americans over the age of 20 should have their cholesterol level measured at least once every 5 years. Our pediatric guidelines say that children between the ages of 9 and 11 should have their cholesterol checked earlier if there's heart disease in the family. Unfortunately, only 10% of children are having their cholesterol measured. And all Americans should talk to their doctor about having their Lp(a) measured, but there are other ways that they can have their LDL and Lp(a) measured, like our program through the Family Heart Foundation and Cholesterol Connect.
And Catherine, let's turn to you. How is your organization working to fight this epidemic?
What we know is that the biggest problem with cardiovascular disease is that the first symptom is often a stroke or a heart attack. And because many people have never been screened for high Lp(a), it is not part of standard lipid panel testing. Although cholesterol testing is, you would have to normally ask for a separate test for lipoprotein(a). And so what we are doing as an organization is trying to offer every American, regardless of whether they live in a big city or in a small town, or they have insurance or not, the opportunity to be empowered and understand what their LDL cholesterol level is and what it should be by talking with some of our care navigators, and whether or not they have high Lp(a). So we're offering a free screening and support service in hopes that people will understand whether or not they're at risk, because time is of the essence.
Catherine, you're not only the Chief Medical Officer of Family Heart Foundation, CEO, but you've got a connection to this cause, I understand. Can you share a little bit about your journey?
I started the organization after I had a heart attack at the age of 39. And what I later discovered was that I have familial hypercholesterolemia, which is a genetic form of high cholesterol, and elevated lipoprotein(a). And again, the biggest point is that these are both very serious risks and they're highly underdiagnosed.
Dr. Sperling, are there any new treatments or therapies available for managing the high cholesterol?
So there are many treatments available. That's really what is important, but there are gaps in knowledge, gaps in awareness, and so empowerment is important. Once you're aware you have a high LDL cholesterol or you're at increased cardiovascular risk, there are safe and effective medications. The sooner we begin those medications, the greater jumpstart we get on heart disease prevention across the life course. So this is really important, and it's important for your viewers to be aware of their risk, bring this to the attention of their doctor or clinical team, and begin on a very valuable journey in heart disease prevention.
And finally, Catherine, is there anything more that we should know, and where can we go if we'd like more information?
If people are interested in learning about the genetic drivers of cardiovascular disease, they can go to familyheart.org. If they'd like to take advantage of our free screening and support program, they can go to cholesterolconnect.org, or they can have a discussion with their doctor. But either way, it really is important to know your LDL and your Lp(a).
Founder, CEO of Family Heart Foundation, Catherine Wildman, and Chief Medical Officer, Dr. Larry Sperling, with some heart health information that we should know. Thank you both so much for your insight today, and may I wish you both happy holidays.
Thank you. Same to you and your viewers.
Thank you now. All right, 7 after the top of the hour. Let's take a quick break here at the desk, and we'll be right back with local news headlines next on KFYR+.